And the reason that that's important, most people, it seemed like really, again, kind of default to the word Alzheimer's as being the same thing as dementia. And Alzheimer's is truly only one form of dementia. The reason that you hear so much about Alzheimer's is because it is the most common type of dementia. And with, like I said, vascular dementia is actually the second most common type. It's not unheard of to have what's called a mixed dementia. That's very common. And that simply means that there is Alzheimer's present, but there may also be, most commonly, a vascular dementia, or maybe a different type of dementia mixed with Alzheimer's. And with that mixed type, it means that it's probably going to be a much faster progression. We have found that with Alzheimer's, if you have someone who really doesn't have, a bunch of comorbidities, a lot of other health problems, maybe they don't have diabetes, they've never really had health problems until Alzheimer's, they stay fully mobile, fully functional, as in physically, for a very long time. But you can live with Alzheimer's for, it's not unheard of to be 15, 17 years. It's a slow progression. Now, if you have a mixed dementia and you do have Alzheimer's, but there's a presence of another type of dementia with it, it's going to progress faster. Other types of dementia tend to progress faster than Alzheimer's. And I have to kind of spotlight a little bit what's called Lewy body dementia, because Lewy body dementia presents a little bit differently than other types of dementia. And for someone who's providing care for someone with Lewy body dementia, it's a completely different level of frustration. When you think about dementia, you think about, starting at one level and having a slow progression downhill over months, over years. It depends on what type of dementia, but in general, you think about it as a slow progression that really you just can't control. And while that's frustrating, you can probably take a day-to-day schedule and you can say, well, we're going to do something at 10 o'clock in the morning because, my loved one is functioning better at 10 o'clock in the morning, whereas about 3 o'clock, he's having some sundowners. And so there's increased confusion. Maybe there's some agitation, and it's pretty routine with sundowner syndrome. And again, that just means at some point in the afternoon or the evening, there may be an escalation of symptoms and more confusion. But with Lewy body dementia, the frustration is really in that you can't predict even on a day-to-day basis. Because Lewy body dementia, you could have someone who is up and dressing themselves and having a conversation, having breakfast, and really seeming pretty normal. And 2 hours later, they are curled up in the fetal position in a bed and they're nonverbal. And as someone who is, partnering for care, or providing care for someone like this, it's very frustrating if you don't understand Lewy body dementia, because you tend to feel manipulated, or, I like to use that word played, like people say sometimes, because you see this person and you see what they were just doing, and then all of a sudden they just can't. And people that don't understand it's truly disease process, they tend to think, well, I know that you just did this. I know you can, you just don't want to. And so the frustration level for someone that's providing care for someone with Lewy body dementia is a whole other level of frustration, truly. So it's pretty important in cases like that, especially that you get an accurate diagnosis and that the physician can explain to you what the progression is going to look like, because it is different than what you usually hear about. If you think about anybody, or if you've ever known anybody with Lewy body dementia, you might think back to Robin Williams several years ago. He had Lewy body dementia. He had Parkinson's. We see Lewy body dementia oftentimes in people that have Parkinson's. It's not necessarily always the case. And you could have Lewy body dementia and not have Parkinson's, but it seems to be a little more prevalent in people with Parkinson's. And unfortunately, it's a very difficult, a difficult dementia to deal with, just on a whole different level. So I do have to point that out in case you're dealing with that. Also, when you get that diagnosis of dementia, I think that there's probably no other point in time where you feel quite so out of control. And nobody wants to feel out of control. But when you get that diagnosis, whether it's for yourself or for someone else, the incredible anxiety that comes with that it's overwhelming. It's unspeakable until you're put in that position. And you want to find a way to take control. And you can look back to studies, heart disease and cancer actually have a higher prevalence of death, but over dementia. But if you ask someone what they'd rather be diagnosed with, they would pick heart disease or cancer over dementia. And the reason that we have found for that after many studies is because, with dementia, there's no cure. There's no real treatment other than maybe some medicines to hopefully slow the progression, but there's no cure. And with heart disease and cancer, we have aggressive treatments for those things. So there's this little bit of hope that maybe we have the power of choosing something to deal with our diagnosis. And with dementia, we really don't. And so it's really a sense of complete helplessness with that diagnosis. So I like to point out one of the ways that you can help yourself with dementia is by looking up the global deterioration scale. And I will try and remember to attach one of those to the email that you get after this class. But the global deterioration scale, you can look it up online if you ever need to, or you wanted to pass it on to anybody. That global deterioration scale is widely used to stage Alzheimer's dementia. That's why it was created, but it's also a really good reference for other types of dementia. And, why do I find that so important? If you've ever had a child or a grandchild that wants to read the same book every night, as I did. My daughter wanted to read the same book every night, and she could recite every page as I was reading it. And so the natural question would be, well, why don't we, read a different book? No, I want to read this one. Well, why do you want to read the same book over and over? Because you already know what's going to happen. Or why do you want to watch the same movie over and over? You already know what's going to happen. And my answer to that is you want to read that same book over and over, or watch that same movie again and again, because you already know what's going to happen. And so there is such control, a feeling of control in knowing what's going to happen in the future. So I equate that same feeling, have that global deterioration scale in front of you, because while there's no treatment, there's no cure for dementia, you can certainly use that global deterioration scale as a guide to know what's going to happen next. And having that expectation, having that in front of you is very empowering. So I really highly recommend that you keep a copy of that and you share that with anybody who is dealing with a similar situation that you might be. It's just a really good reference. It's not necessarily going to be the same for everybody, but you can truly see where you're at in the process